Now we will talk about the last part of the lecture, which is about the respiratory diseases in pregnancy. We will have the bronchial asthma. It is a most common respiratory problem seen in pregnancy. It's either worse, the symptom and the condition will be deteriorated, or improves, or it remains stable. If controlled, it is saved in pregnancy. It affects about 8 to 12% of cases of pregnancy. The complication, we may have preeclampsia, IUGR, low birth weight, premature labor with increased cesarean section. We diagnose this condition by taking detailed history. The woman who told you that I have this chronic disease. We do clinical examination to assess the respiratory function of the lady, and we can send for pulmonary function test. We manage her by education to avoid the triggers for having the attack, and low dose of inhaled steroids by inhalers can be also safe in pregnancy. And if she had severe asthma, we may give oral, systemic, or injectable steroids. Beta agonist therapy is also safe. For example, salbutamol can be used inhalers or orally. In cases of acute severe asthmatic attack, we will advise for inhaled salbutamol 2.5 mg every 20 minutes with systemic steroids. Inhaled ipratropium bromide can be added to this regime, and monitoring should be provided for this lady every 30 to 60 minutes for any signs of hypoxia with fetal well-being assessment. Regarding TB, the treatment is similar, and it is lesser incidence in pregnancy nowadays, and the treatment is similar to non-pregnant status except for streptomycin, which is contraindicated in pregnancy. Breastfeeding is not contraindicated in women with treated TB. Now we'll talk about pneumonia. It is one of the important causes of maternal death. Most common causative microorganism is strep pneumoniae, Haemophilus influenzae, and if we have mycoplasma pneumonia, can result in more deterioration. The woman will have same clinical features, but more risk for deterioration to respiratory failure. And we should have, if we need, a chest x-ray, but you should provide abdominal shield to prevent exposure of the in utero fetus for x-ray. We don't allow the women to take tetracycline or quinolone as part of the treatment for this condition. This is the end of our lecture about the liver and respiratory diseases of pregnancy, and I'm ready for any questions or explanation. Thank you very much.